trying to conceive but unsuccessful? Have been advised IVF or IUI? Want a healthy and intelligent baby? Join us to fulfill your dream of becoming parents. A free expert guidance program on holistic IVF and IUI, scientific and spiritual approach, golden steps for successful IVF and IUI, daily online live sessions by expert medical doctors and spiritual teachers on decoding journey of IVF, tips for successful IVF, stress management, emotional well-being, fertility boosting diet, exercise and pranayam, counseling, meditation, sleep management, art therapy, music therapy, instrumental music meditation, value stories, Gita Gyan and scriptures, Ayurvedic and naturopathy detoxification, Garbhadhan. Starting from 1st November, meet us virtually from Monday to Saturday between 8 to 9 pm and Sunday between 11 am to 12 pm. Live on Zoom and YouTube channel Holistic IVF. Zoom meeting ID 919-519-84746. Password happiness. For more details, call us on 9158-927-937 or 98-206-16509 or 9833-801-570. You can mail us on holisticivf@gmail.com. Visit us on www.divinegarbhasanskar.in. Subscribe to our YouTube channel, Holistic IVF. Organizers, Medical Wing Brahmakumaris, Divine Sanskar Research Foundation.
ओम शांति, गुड मॉर्निंग। आज के ये होलिस्टिक आईवीएफ के संडे के सेशन में आप सभी का बहुत बहुत स्वागत है। आज हमारे बीच बहुत ही एमिनेंट पर्सनालिटी आए हैं जिनका नाम है डॉक्टर राधिका नायक, हुबली कर्नाटक से, जो एक बहुत ही सीनियर गायनेकोलॉजिस्ट है और बहुत ही सुंदर टॉपिक लेकर आए हैं, ऑर्गेनिक से आरोग्य का नया सवेरा। आज नया भी टॉपिक है और बहुत सुंदर टॉपिक है, तो बहुत ध्यान से सुनेंगे। मैं शॉर्ट से मैडम जी का परिचय देना चाहूंगी। मैडम का बहुत अच्छा पोर्टफोलियो है, मैडम ने खुद ही भेजा है हमें, उनके ही शब्दों में बारे में पढ़ूंगी। मैडम का बर्थ उत्तर कर्नाटका में हुआ है और वो मैंने लिखा है कि आई वॉज रेज्ड एंड एजुकेटेड इन मुंबई, स्टडीड एट पाले तिलक विद्यालय, विले पाले, where I completed my schooling, and I was the topper in middle school and high school scholarship exams and also in SSLC exams. I further went on to my study at Pale College for the inter-science exams. I enrolled at the Grant Medical College, Mumbai, where I studied medicine and was awarded the distinction grade in surgery, obstetrics and gynecology subjects. Recently on 12th January 23, my unique health promoting product, organic, biodegradable, dioxin free and anion sheet sanitary pad delicate touch won the best innovator award at the All India NHF Summit in the New Delhi. तो इतनी सुंदर पर्सनालिटी आज हमारे बीच आए हैं, बहुत सुंदर टॉपिक लेकर आए हैं। मैडम आपका बहुत बहुत स्वागत है। ओवर टू यू मैडम, आप अपना सेशन स्टार्ट कर सकते हैं। थैंक यू मैडम। ओम शांति।
थैंक यू एवरीबॉडी। आज संडे के सुबह में आप सब लोगों ने मेरा ये लेक्चर सुनने का सोच लिया है और आप आ गए हैं, इसके लिए आप सबको धन्यवाद। आप कहाँ से, जगत के कहाँ से यहाँ कनेक्ट हो गए हैं, इसके लिए आगे का जो आधा पौना घंटा में आपको सब बता दूंगी। और इसके बाद में जब आपको मैं लेक्चर देते टाइम सब एक बात कंप्लीट कर दूंगी, और जब मेरा खत्म हो जाएगा, आपको कुछ भी मन में प्रश्न वगैरह रहे तो वो प्रश्न आप मुझे लिख के आप रखना, और मैं खत्म होने के बाद आपको पूछूंगी, वो हिसाब से आप मुझे बता देना। सो मैं उस टाइम आपके सब प्रश्नों का उत्तर देने का सब प्रयास करूंगी, और उससे मुझे अच्छा लगेगा कि आप ये कर लो, और आप ये मैंने जो कुछ बताया है उसका पूरा का पूरा फायदा ले लो। हाँ, इसके लिए मैं आपको अभी मैं लेक्चर स्टार्ट कर देती हूँ। जो लेक्चर अभी एक मिनट है, मैं सब स्क्रीन एडजस्ट कर लेती हूँ पहले। हाँ, अब साउंड है कर दूँ,
ಸೌಂಡ್ ಇದೆ ಮೇಡಮ್
ಈಗ ಏನು So I think you can see the full screen. आपको सुन रहा है क्या?
मैडम जी, मैडम दिख भी रहा है अच्छे से और सुनाई भी दे रहा है।
हाँ, सुनाई भी दे रहा है ना? ओके, तो मैं अभी देखिए ये इसका जो आपने इसका इट इज रीडिंग एज न्यू डॉन ऑफ अ हेल्दी मेंस्ट्रुअल लाइफ, आरोग्य का ऑर्गेनिक से आरोग्य का नया सवेरा। तो वो मैं आपको अभी क्या बताऊंगी कि हम जो नया सवेरा है वो देखने के लिए हम चालू करेंगे हमारी जर्नी, और क्या कैसे करना है ये सब मैं आपको बता दूंगी। इसके पहले आप 2 मिनट एक वीडियो देख लेना, वो वीडियो के बाद में मैं मेरा लेक्चर स्टार्ट कर दूंगी। सुन रहा है ना? सुन रहा है? साउंड शेयर मजेला?
जी मैडम आ रहा है, आवाज आ रहा है।
हाँ,
मैम इस वीडियो को भी आवाज है क्या?
क्या आ रहा है?
वीडियो का साउंड नहीं आ रहा है, आपका आ रहा है?
वही मैं वो पूछ रही थी।
हाँ जी,
साउंड शेयरिंग ಮಾಡಬೇಕು ಎಲ್ಲಿ ಮಾಡಲಿ ನಾನು?
ಇಲ್ಲೇ ಅದು ವಿಡಿಯೋಸ್
ಇದು ಚಾಲು ಮಾಡ್ಲಿ? ಎಲ್ಲ ಹೋಯ್ತಲ್ಲ, ಎಸ್ಕೇಪ್ ಮಾಡ್ತೇನೆ. ಹಾ, ಇದು ಸೌಂಡ್ ಶೇರಿಂಗ್ ಎಲ್ಲಿ ಇದೆ?
मैम एक बार है ना शेयरिंग आप स्टॉप कीजिए, और जब आप शेयर करेंगे ना
हाँ
तो उस वक्त नीचे 2 ऑप्शन आते हैं साउंड शेयर का,
हाँ,
फिर वो करके शेयर कीजिएगा।
मैं एक मिनट है, मैं देख रही थी।
एक बार स्टॉप करके देन अगेन शेयर।
ओके, आई विल गो बैक एंड आई विल डू दैट। हाँ, स्टॉप शेयर।
स्टॉप शेयर आइए।
हाँ, सो शेयर स्क्रीन करने का,
शेयर स्क्रीन करने के बाद नीचे शेयर साउंड 2 एक बॉक्स है मैम,
यस आ गया।
हाँ
आ
उस पे
गया।
क्लिक कीजिएगा, एंड ऑप्टिमाइज फॉर वीडियो क्लिप भी इस पे भी क्लिक कीजिएगा, दोनों ऑप्शन।
ऑप्टिमाइज फॉर वीडियो क्लिप। हाँ
हाँ बोथ
हाँ,
ऑप्शन,
okay.
देन राइट साइड शेयर ऑप्शन होगा, उस पे
हाँ
क्लिक
हाँ
कीजिए।
हाँ हाँ,
यस
आ गए? अब दिख रहा है ना?
हाँ मैम दिख रहा है जी।
ಫುಲ್ ಸ್ಕ್ರೀನ್ ಆಗೈತಿ. ಈಗ ಇದು ಮಾಡ್ತೇನೆ, ಚಾಲು ಮಾಡ್ತೇನೆ. ಕಲಿಯಕ್ಕಾಗಿಲ್ಲ. ಇಲ್ಲೇ ಇಲ್ಲೇ ಏನ್ ಮಾಡ್ಬೇಕು? ಇಲ್ಲೇ ಕ್ಲಿಕ್ ಮಾಡಿ. ಇಲ್ಲಿ
Girls in a high school from a village were asked to take free annual medical
यस मैम
checkup.
अभी सुनाई दे
The
रहा है।
necessary setup was ready with doctors, nurses and lab technicians. Everyone was checked one by one with physical checkup, and their family health history was also noted. Next day, all the reports had come. The
वीडियो नहीं
shocking
आ रहा है
result
स्क्रीन
was
पर
that
मैडम
80%
वीडियो
girls
इसको
had some
क्लोज
or the other
रखिए
health issues and also
Can you
have
hear it?
strong family
वीडियो
history of
स्क्रीन पे
cancers
नहीं
of
दिख रहा
different
है खाली
organs,
आवाज आ रही है
diabetes, high
वीडियो
blood
शेयर करता
pressure, or
हूँ
वीडियो नहीं दिख रहा
hypothyroid.
है?
The
नहीं
health
नहीं
problems found were
How did
anemia
it-
due to more menstrual bleeding, PCOS causing irregular periods, underlying endometriosis causing severe menstrual cramps, infections of urine,
This is not only a problem with females, but it's a huge problem across the world having multiple dimensions.
समझे आवाज आ गई ना? It is stop mode.
causes dioxins entering into the body by using non-organic sanitary pads and
No,
other hygiene.
video, can you see video?
जी जी
हाँ,
अभी आ रहा है वीडियो
हाँ. So we can start from day one.
Girls in a high school from a village were asked to take free annual medical checkup. The necessary setup was ready with doctors, nurses and lab technicians. Everyone was checked one by one with physical checkup and their family health history was also noted. Next day, all the reports had come. The shocking result was that 80% girls had some or the other health issues and also have strong family history of cancers of different organs, diabetes, high blood pressure or hypothyroid. The health problems found were anemia due to more menstrual bleeding, PCOS causing irregular periods, underlying endometriosis causing severe menstrual cramps, infections of urine, vagina and local fungal skin infection, raised blood pressure and blood sugar and also infertility. This is not only a problem with few females, but it's a huge problem across the world having multiple dimensions to it. These female health problems are monstrous and causing threat to life in the form of cancers, and the cause is dioxins entering into the body by using non-organic sanitary pads and other hygiene products during menstrual cycles. Dioxins gets into these products during its bleaching process by chemicals. As they are non-biodegradable, cause environmental pollution. This is a serious issue and there's got to be a solution. Well, here it is. Say no to non-organic hygiene products and no to dioxins and turn to health promoting, providing and protecting organic sanitary pads. Katyayani Enterprises has invented a unique solution through Delicate Touch organic, biodegradable, dioxins-free, and ion sheet sanitary pads, making it different and absolutely safe to use. Its usage gives protection from cancers of different organs, freedom from different infections mentioned previously, menstrual cramps, bleeding patterns and mood swings. Protects present and future generations. Its disposal in soil enriches earth as it turns into compost due to its biodegradability. It's very cost-effective and affordable compared to most products available in the market, making it accessible also to the women who were not able to afford it till now. These pads are checked and certified by well-known reputed lab Testex Laboratories, India, Mumbai. Join hands with Katyayani Enterprises to spread a word about this life-changing and health-promoting revolutionary product. Let's help each and every woman live with good health, tension-free and with pride. Contact now, +9 1 7 7 6 0 9 3 1 0 3 8.
Next month. क्या करूं? Next month, next page.
Girls in a high school from a
See, now coming to the point. All this time we have seen that one school, whatever the thing, checkup was done and all that. So usually this is done regularly. If you see we celebrate women in our life in the year, at least per month 1 day, like that we get 7 to 8 days in a year. If you take it as a 1 month, one celebration, if you take it like that, so out of 12 days, 6 or 7 days are given to the women's celebration. So we celebrate womanhood all throughout the year, right? Starting from the January, Daughter's Day is there. Then Sister's Day is next. Is Sister's Day is there. Then the March comes, the Women's Day is there. Then in May, there are 2 days, Mother's Day is there, Menstrual Hygiene Management, MHM Day is there. Then comes the Earth Day is there, or then comes the Environment Protection Day, comes the Green Day is there. So there are so many days in the year we celebrate in the different ways. Either we celebrate a Mother Earth, or we celebrate a mother or a woman in her any form, as a daughter or as a sister or as a mother or otherwise. So in that way we celebrate. But if you go really see it, so whether women's health is matters, like we talk all that, but really we are giving proper justice to that or not, that we have to see. So are we achieving it in reality? That is what we have to say. So see, because being a woman is not an easy thing, it is the most challenging thing. They are, as other responsibilities are there, as a man they follow it. Along with that, they have a responsibility of bringing बच्चे को उभार, बच्चे को पेट में रखना, उसको जन्म देना, वो जन्म के बाद में उसको देखना, ऑल थ्रू आउट द लाइफ वो सब उसको देखना, उसका सब करना, ये सब महत्व का रहता है. और ये सब, और उसमें वो क्या होती है, उसका रिप्रोडक्टिव एज 10 साल से चालू हुआ समझो, तो उसका रिप्रोडक्टिव एज का खत्म होता है 50 साल में. सो 40 साल, 50 और 40, 55, सो 45 इयर्स वो सब चैलेंजेस स्वीकार करती है. और उसको डिफरेंट चैलेंजेस आते हैं, उसमें प्यूबर्टल चैलेंजेस रहते हैं. तो प्यूबर्टल चैलेंजेस में वो अप टू द एज ऑफ 18, 19 और 20, जो नया उसको पीरियड 12-13 साल से चालू है, तो उसके बाद में वो शी एंटर्स इनटू द आफ्टर मैरिज इनटू द मदरहुड. सो वो टाइम तक का उसका प्यूबर्टल चैलेंजेस रहता है. प्यूबर्टल चैलेंजेस में उसको क्या रहता है कि दे हैव टू, मूड स्विंग्स हो जाते हैं. मूड स्विंग्स इन द सेंस, दे ऑल दिस डेज, इतने दिन तक वो एक लड़की थी, फ्री थी, जैसे पंछी घूमता है वैसे घूम सकती थी. जैसे उसको पीरियड स्टार्ट हो गए, उसको समाज की तरफ से और घर की तरफ से उसको रिस्ट्रिक्शंस आ जाते हैं कि ऐसा करो, ऐसा नहीं करो, ये करो, वो करो, इससे बात करो, उससे बात नहीं करो, खुद का ख्याल रखो, वगैरह वगैरह. तो उसको लगता है कि ये सब मुझे पीरियड स्टार्ट के होने के इसी वजह से होता है, और इसके लिए शी स्टार्ट्स हेटिंग पीरियड्स. एक्चुअली औरत के लिए पीरियड्स ये एक वरदान है, बुन है. इट इज अ बुन फॉर अ वुमनहुड, बिकॉज शी इज लेबल्ड एज वुमन जस्ट बिकॉज ऑफ दैट ओनली, कि शी इज गेटिंग अ पीरियड. गेटिंग अ पीरियड मीन्स व्हाट, गॉड हैज गिवन हर अ सर्टिफिकेट टू रीजनरेट. नई पीढ़ी, नया जमाना, नया जमाना तैयार करना, नया वर्ल्ड तैयार करना, ये उसको कैपेसिटी दी होती है भगवान ने. तो वो हिसाब से उसने करना है. तो उसको हमने उसका मानसिक संतुलन, हर मेंटल बैलेंस, we should always see that she remains in a very balanced minded mental state, and for that purpose we have to do the counseling. So that counseling should be done either from mother's side or from the school side. So that is very important. These are the pubertal challenges, otherwise they go into deep depression. So unko batana chahiye, we have to tell them that this what you are going to go, you should celebrate it. You should celebrate your puberty and take the vow that I will celebrate it, I will use it properly, and I will see that the generation next going to be born through me will be the best one. I will take care of it. So that mental status we should give her. That is the pubertal challenge we should take, and tell her that it is not something which you should be ashamed about, because of her mother also. She is born because of her mother got her periods. Like that, her mother is born because of her granny got her period. So like that, it will go on. So please not to feel like that. So then we have to treat. The next comes as a childbearing challenges. When the childbearing challenges will be when the mother she has to look after her family. Then at the same time, then she has to look after her pregnancy. She has to look after if she's lady who is earning, she's a working lady, then she has to go and attend office also. So she has to do a man's part also, she has to do a woman's part also, she has to take care of her baby also, all that. So there are many challenges. Actually, that is the age when they are supposed to be having the lot of energy. In the 20s to 30s, 35, they have to have the lot of energy, and that is the right time to get children, and then sustain it, and then get the new generation on. So, but they have to face that challenges. Then there comes the last part is a menopausal. So menopausal challenges. So one lady goes through all that pubertal challenges, childbearing challenges, and menopausal challenges. Menopausal challenges are the, like how pubertal challenges are there, the same type that menopausal challenges are there. That time again there are a lot of body changes will be there. तो उस टाइम शरीर में काफी चेंजेस हो जाते हैं, जिसमें उनको पीरियड्स बंद होने आता है. पीरियड्स बंद होने की वजह से हार्मोन्स के आगे पीछे होने की वजह से, अप डाउन की वजह से उनका बॉडी स्टेटस में, उनके बोन्स का कंडीशन, उनके हार्ट का कंडीशन, उनके ब्रेन का कंडीशन, ये सब चेंजेस हो जाते हैं. एंड इसके लिए उनको वो डिप्रेसिव स्टेट में जाते हैं. शारीरिक वीकनेस आती है, स्नायु की वीकनेस आती है. दे कैन नॉट परफॉर्म द सेम थिंग एंड दे वर परफॉर्मिंग स्टरियस. सो ये सब उनको डिप्रेशन देता है कि मैं कल तो अच्छी तरह से काम कर रही थी, नाउ आई हैव टू रिटायर फ्रॉम माय दिस वर्क. So that is also a challenge. So we have to look after all that. So this is I'm starting my journey to the explaining womanhood and why we should go learn all these things. Now coming to the point कि हमने अब सब क्या किया. Woman is known because she gets a period regularly. That is the thing. It makes her a woman. So now coming to the period part of it. So the thing which is giving her a full right to enjoy her womanhood is her periods. If you see medically also, because a lady, a female sex is a stronger sex than a man. And that is because of her estrogen and progesterone. She is protected till the time she has got her period. She is protected from heart attacks and bone damages. All these things, no, she is protected from. So uska cardiovascular system, brain system, and all that is protected because of her hormones. The moment she attains menopause, she becomes equally susceptible as a man. So this makes her an additional edge over the gender. The male gender, she gets the edge over that just because she's a woman. So you should feel proud that you are a woman. You have got some more powers, and understand it and make use of it rightly. So the power which you are getting because of the estrogen and progesterone is because of you are getting periods. So that is a important thing, is you have to take care of your period health. Period health is very important that you should take care of, because the whole thing is, that is a soil, that is a earth, mother earth, where the soil will, there will be germination will be there will be child will be growing it, and then a good next future generation for the world globe will be born. So you should take care of that soil very much. So it is very important. So what is it? Because what is there in society, this topic is not discussed up till now also. Though we are in the 21st century, we don't openly discuss this in India, at least, that sitting in the one place and discussing. No, what will happen, that mother and daughter will be the mother will take the daughter at one room, then she will say, and they say, don't say it loudly, no one should hear it, and this and that. So then because of that, this social taboo, the daughter gets more feeling that this is something wrong to get the period. So that should not happen. You should sit. See, the day when you can sit with your father and brother and discuss your period problems with your mother, and this, that is the day where the real freedom will be there. So everybody should be aware there is nothing wrong in that, because this will give awareness to the even the male partners, male people in male gender in your family, that what is their responsibility towards you when you are menstruating. and when you have become an adult, when you have attended your puberty, so from that puberty time to your menopause time, what is their responsibility towards you, they should understand. So that day should come, the day should come that everybody, सब लोग साथ में बैठ के ये डिस्कस करना चाहिए. सो ये अभी मैं प्रयत्न कर रही हूँ कि ये ओपन होना चाहिए, ऐसी बातें होनी चाहिए. सो ये हिसाब से मैं बात कर रही हूँ. सो अभी क्या करना है कि वी हैव टू सी दैट व्हाट इज, अभी बुद्धा जी ने बोला है कि अ गुड, टू कीप बॉडी इन अ गुड हेल्थ इज अ ड्यूटी, otherwise we shall not be able to keep our mind strong and clear. So healthy mind is in the healthy body. So शरीरम आद्यम खलु धर्म साधनम, ये संस्कृत का श्लोक ही है कि शरीर ये धर्म साधने का, खलु धर्म साधनम, शरीरम आद्यम खलु धर्म साधनम. सो अच्छा शरीर, धर्म साधना करने की जरूरत है, तो धर्म साधना करनी है तो अच्छा शरीर रखना चाहिए, और अच्छा शरीर के लिए अच्छा, उस शरीर में अच्छा मन रहता है. तो अपने शरीर की अपना ख्याल रखना है, अपनी जिम्मेदारी ही है. सो अभी क्या है इसका, जो अभी मैंने बोला कि ये सब चैलेंजेस हैं, वो चैलेंजेस का सॉल्व करना है तो अवेयरनेस होना चाहिए. अभी वो सॉल्यूशन क्या है कि अवेयरनेस. सो अवेयरनेस क्यों होना चाहिए, भगवान कृष्ण ने गीता में बताया ही है कि जब हम एज अ ह्यूमन बीइंग, when you are born as a human being, because you are different than other animals. God, you are made in the image of God, कि आपने, भगवान ने आपको अपने जैसे ही बनाया है. सो जो भगवान के पास है वो सब आपके पास है, लेकिन आपको मालूम नहीं है कि ज्ञान क्या है और कितना ज्ञान आपको है. तो वो समझाने के लिए आपकी जरूरी है कि आप ये साधना करके वो ज्ञान मालूम कर लेना. जिसको ज्ञान मालूम है उससे आप ले लेना, because you cannot act without knowing the effect of it. तो हमेशा ध्यान रखना कि कौन सा भी कार्य करते टाइम उसका क्या परिणाम है, वो आप पहले ध्यान रखना और उसके तरीके से करना. सो दैट इज द नेक्स्ट इज नाउ. मैं तो गायनेकोलॉजिस्ट हूँ, इसके लिए जब प्रैक्टिस की, अभी 40 साल की प्रैक्टिस हो गई है, तो मेरे प्रैक्टिस में मैंने इनफर्टिलिटी मेरा सब्जेक्ट था. तो वो इनफर्टिलिटी सब्जेक्ट में मुझे ध्यान में आए कि क्या क्या प्रॉब्लम्स मैंने ज्यादा देखे. तो पीसीओडी contributes to the lion's share of all the gynecological complaints. Irregular periods, unwanted hair growth on the face and other body parts, acne, hair loss, ये सब इसके साथ, पीसीओडी के साथ आ जाते हैं. यंग एज में अब जब हम ये लड़कियों को या औरतों को हम एनालाइज करते हैं, उनका इन्वेस्टिगेशंस करते हैं, तब हमें क्या होता है, कभी कभी उनकी फैमिली हिस्ट्री तो रहती है, डायबिटीज की हो, हाइपोथायराइड की हो, रिप्रोडक्टिव की सिस्टम की कुछ प्रॉब्लम्स, यूरिन, ये सब उनके प्रॉब्लम रहते हैं. और जब उनका ब्लड टेस्ट वगैरह सब करो तो ऐसा भी हो सकता है कि वे बॉर्डर लाइन पे उनका भी डायबिटीज का कंडीशन हो, प्री डायबिटिक बोलते हैं वैसे, उनमें भी हाइपोथायराइडिज्म हो सकता है, और रिप्रोडक्टिव के कुछ कुछ प्रॉब्लम्स और उसमें से दिख सकते हैं, एंडोमेट्रियोसिस जैसा प्रॉब्लम आज दिख सकता है. अभी सच में मैं बोलूं तो मैं जब जब अवेयरनेस प्रोग्राम देती हूँ, स्कूल में हो, कॉलेज में हो, तब मैं उनको पूछती हूँ कि ये जब सब नाम लेती हूँ ना मैं, कि अपना पीसीओडी हो, एंडोमेट्रियोसिस हो, ये सब नाम लेती हूँ, हाइपोथायराइड हो, इवन स्कूल के लड़कियों को जब मैं बोलती हूँ तब वो तो मान हिलाते हैं ऐसे 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 करके, दे जस्ट डू यस नॉडिंग. Yes nodding is what they know, they are aware of all these problems. So young age में भी उनको ये बड़े बड़े रोगों की कल्पना है, all these big diseases they know it. When I was studying as a medicine student, there all these names we started hearing them. Hypothyroidism, so we read it, but after around 2005 and 6, we started seeing it regularly. Before that, it was hardly there. We saw some sporadic hyperthyroidism, not hypothyroidism, and our teachers used to tell us that ki diabetes, blood pressure, hypothyroid, ये सब चीजें if you have to investigate, You have to investigate a person who is above 50 or 55. Don't do before that. You are wasting their money. And now if you see in the society, right from the young age, 5, 6 year, other day, one 7-year-old boy, he's got diabetes, his blood sugar was 561. So what is the thing? It is, where are we? And when we talk all this, what people say, ये तो क्या रेगुलर है, सब घर में ऐसा, एक तो बीपी रहना, शुगर रहना, थायराइड रहना, या किसी को कैंसर होना आजू बाजू में सोसाइटी में, तो ये आजकल घर घर की बात हो गई है. सो लाइक दे हैव स्टार्टेड एक्सेप्टिंग द डिसीजेस एज अ नॉर्म. What does it say? That they are accepting diseases as a norm, and which is a very dangerous status. Ki God has not sent us diseased. God has given us health, and we have, because of our wrong behavior, we have made it disease, and we have started accepting disease as a norm. So that status should go. Because of that, the young generation, the future of our nation, future of our globe is getting destroyed in this only. At very young age, they are going off. And only old people staying, what they are going to do? They don't have energy also to work for. What is there to be? So we have to take care of all these things. So even the young urinary tract repeated infections, fungal infections, vaginal infection, all that is there. And when you, when you start to investigate, no, investigation and treatment takes a lot of financial burden on pocket of the father or bread earner. And then after some time, if you maybe around 7-8 months or down the 1 year, again the patients come with the same problem. PCOD, endometriosis, all that. And hypothyroid or diabetes means you have to go on lifelong on the medicine. So at one stage I started feeling ki ye kya hai? What is this? That why there are revisits of these diseases once we treat it. First of all, why they occur. That is the main thing, because yesterday it was not there. अभी की इसमें क्यों ऐसे बार बार ज्यादा दिखते हैं आपको, और इसके बाद में वो जब हम ट्रीटमेंट देते हैं उसके बाद में why there are revisits, मींस वो फिर से क्यों हो रहा है. सो ये देखते तो वो स्टडी करते गई तो मुझे उसमें से कुछ चीजें ध्यान में आ गई. अभी ये नहीं था मैडम. So what the researchers say? The researchers say that dioxin is the main cause for all such health issues. So whatever issues I told in this previous slide, so research is done on that, and that researchers say that it is the dioxin. It is the dioxin which is causing all this problem. In that, I will mention too the Women's Voices for the Earth. That is from the Missouri, USA, and Endometrial Research Center, California, that is also USA. These are the two strong bodies that they have done a lot of research in that. And then they have come to the dioxin is a problem. So from where the dioxin is entering into the body? See, some time back I had inquired in few labs, big labs, regarding thyroid problem. So I just asked them, what is the gender difference when your lab gets the blood picture? Because nowadays what has happened, we have to screen each and every patient for thyroid. Thyroid functions has to be checked for each and every, which were not there in our early practice. Early practice, it was not there, now everything. So they get a lot of cases for the blood test of the thyroid. So I asked the laboratory people that what is your gender difference? So it was shocking. They said, madam, almost 100%, means 99.9% you take, are female gender. So female gender is more susceptible for the hypothyroid. And you will also see that in your family or in some around, you will find only female having the hypothyroid. So what is that they are making them more prone for the hypothyroid? So here the answer is the market available hygiene products, menstrual hygiene products contain dioxin. These are, what is the dioxin's function? Dioxin is a hormonal disruptor. Then it is a carcinogens. Carcinogens means it has got capacity to change a cell, normal cell into the cancer cell. So that is the capacity of dioxin. Then third is the surface irritant. It irritates the surface of the cell, and it is even the pads which are written as a biodegradable, dioxin labeled, they are not, but not organic. They are not dioxin free, because they are made from the dioxin. They are made from the biodegradable plastic. So biodegradable plastic, once it is a plastic, it is not dioxin free. So anything, when they are called only biodegradable, not mentioned as organic, or they don't have a proper certifications, the thing is not free from dioxin. So you have to understand that. So in this marketable hygiene products comes tampons, sanitary pads, and diapers. So either you take the baby diapers or adult diapers. All these are with the dioxin only. So now we have to say that dioxin is causes and effects. So first we have to see that how this dioxin comes into the sanitary pad, because first we have to see how we have to go to that birth of that sanitary pad, how they are manufactured. Manufacturing tampons, dioxin of this sanitary pads, or diapers, they are made in the same way. The same material is used for their manufacturing. So once we know that where the thing is happening, what is going wrong, and where the dioxin is entering, so they are made from this only these 4 items. They are synthetic fibrous rayon, the recycled paper, then industrial waste, and dust, wood dust. These are the 4 items: wood dust, petrochemical waste, synthetic rayon, and recycled paper. These are the 4 items which are used for the manufacturing of this product. So once that product, the pulp is made, the pulp is not white. So to make it white, they bleach it. So till now in this, there is no dioxin. But the moment it is bleached, the bleaching is done to make it a pure white. Pure white means whiter than the cotton. So that pure white, when they make, in that time they use it chlorides or non-chlorides as a for this thing, their bleaching. And that bleaching agent which contains that dioxin and trihalomethane, there are 2 dangerous contents in that. So that dioxin, the capacity is 6-7 times it is washed to make it white. And that dioxin's another very important status is it is very slow biodegrading. Means its half-life is 30 years. So what does it mean by half-life is 30 years? Once it enters into the body, एक बार वो शरीर में घुस गया, वो उसके पूरी जिंदगी तक साथ, मरने तक साथ देता है. जैसे LIC का बोलते हैं ना कि all throughout life. So वैसा ये आपको LIC जैसा एंड तक, आखिर तक वो आपको स्मशान तक पहुंचाएगा. कौन? डाइऑक्सिन. So it is that attaching to your body. So you have to be very careful whenever you are using anything which is of having any dioxin content. So on that, they use plastic cover. Market available sanitary pad is having only 3 layers. Top layer is plastic, middle layer is pulp, the lower down is a sticking layer. And on that ready pad comes, and poor girl from her puberty till menopause, she sits on it and finishes her all reproductive life like that only. So it is a very sad state without understanding. It is not her mistake. It is not her mother's mistake. It is not anybody's mistake. It is our mistake that we have not understood what you are using is correct or not, whether it is friendly or not, whether it is hygienic or not. That we have not understood. Where God says that any action should be done with the full knowledge of its good and bad parts. So here it comes where we lack, and it is sin if we don't understand it. It is हमारा ये गुनाह है कि हमने नहीं समझ लिया. So ये ध्यान हमेशा रखना है. So अब ये डेंजर है, ध्यान में आया. अभी ये डेंजर बात है कि डाइऑक्सिन लोडेड पैड आप तक पहुंचता है, आप यूज करते हो. अभी यूज करने के टाइम में आपको क्या क्या हो सकता है? प्लास्टिक कैन गिव इरिटेशन, प्लास्टिक कैन गिव रैशेस, इरिटेशन महसूस होता है, हीट फील होता है, urgency in the urine, white discharge will be there, and then lot many other discomforts will be there because of the plastic. And because it is a plastic, there will be a thin layer of a blood between skin and a pad, and which will give the wetness feeling. That thin wetness feeling is a blood, and that blood is a very good media for anything to grow. Virus, bacteria, and fungus. So all these things will be freely developing there, flourishing there to grow. So there can be local fungal infection, urinary tract infections, vaginal infections, HPV virus infections. HPV is a one human papilloma virus which can also grow and can cause all cancers. So that is what the thing is. So the dioxins acute problems are lack of appetite, physical weakness, chronic tiredness, depression, weight loss, and where the long term will be cancer, chloracne. Chloracne is the pimples, that reddish pimples. Diabetes, damaging the immune system. Immune system gets damaged because of the dioxin. That I'll come to. So now the thing is, that plastic I discussed, the pad contains dioxin, the pulp contains dioxin, which gets into the body system, into the blood system, and that it enters into through the vagina and skin. Capillaries will be there, छोटी छोटी blood vessels रहते हैं, उसमें से वो खून में डायरेक्ट एंटर होता है. अभी वो खून में एंटर होने के बाद में वो वहां कहाँ जाके बैठते हैं, तो वो आपके शरीर में ब्रेन में बैठता है. थायराइड, बोन्स, हार्ट, लंग, हार्ट, लीवर, पैनक्रियास, ओवरीज, यूट्रस, यूरिनरी ब्लैडर, स्किन एंड एडिपोस टिश्यू. एडिपोस टिश्यू मीन्स फैट, जो चर्बी है चमड़े के नीचे, चमड़ा और चमड़े के नीचे की चर्बी, इसमें सब जगह पे जाके बैठता है. वो उसका और एक गुण क्या है, वो हिलता नहीं जगह से, और वो धीरे धीरे से जैसा वो अपने और लोगों को इकट्ठा करके वो उसका लेवल आने के बाद वो एक्शन चालू कर देता है. So every 3 to 4 hours we keep on changing the sanitary pads because of that they want to avoid this dioxin problems. So but every time you are taking the new sanitary pad, you are adding more dioxin in your body. So that sanitary pad is causing the problem. Abhi this when it gets into the brain, what are the side effects of it? There are no good effects of it, all bad only. So side effects are the memory loss will be there. Memory loss in the sense slowly they will start forgetting, or too much stress on that and they will forget what they have to do further and all. So in that bargain, what happens is the student who is studying very well in yesteryears can perform less during in the studies and all that. So children's parents will come and tell you, ये पहले अच्छी पढ़ती थी, अभी नहीं पढ़ती है. Then coming to the woman, if she is a working woman, she will not be able to give proper performance for her workplace. And if she is a housewife, there also she will start feeling tired. कि मुझे बस थकान आती है, काम करने में थकान आती है, मन नहीं लगता है. That thing will start at very young age. Whereas her mother-in-law will say कि मैं अभी तक 60 साल की हूँ, 65 की हूँ, इतना काम करती हूँ, तुम्हें अभी कुछ नहीं, इतने सब इक्विपमेंट्स आ गए हैं, फिर भी तुम्हें काम करने में कंटाला है. All that will come. But they don't understand that what she's telling is reality. So that is a brain. Second comes thyroid. Thyroid, I just said, hypothyroid is the main thing. So it is lowering the functioning of all organs. So the functioning of thyroid comes down. And once you get that status of hypothyroid, lifelong you have to take the medicine. Every 3 months you have to go and assess yourself with the doctor. You have to assess your thyroid status, which will be all the time changing because you are using sanitary pads monthly. And every 3 months you're going to the doctor. So over maybe about 3 months or 6 months, your status of thyroid will change and you have to either increase the dose. I have seen one patient taking 450 mg of thyroxine, means in the sense thyronorm tablet, जो thyroid के लिए दी जाती है, उसका last dose है 150. उसका अभी 450 का डोज दिया था एंडोक्राइनोलॉजिस्ट ने, ऐसा नहीं कि किसी आयरे गहरे ने दिया था। सो एंडोक्राइनोलॉजिस्ट ने 450 mg की थायराइड की गोली उनका थायराइड कंट्रोल करने के लिए दिया था। तो यू कैन इमेजिन द ग्रेविटी ऑफ सीरियसनेस ऑफ द डिसीज से वो औरत के एक थायराइड के साथ और कितने ऑर्गन्स डैमेज हुए होंगे। सो ये कंडीशन आ गई है, वो बढ़ता जाता है, ये करता है। सो फिक्स्ड डोज यू डोंट गेट इट, so that it comes to thyroid. Then comes the bones. It gets attack the bones, bone marrow. उसकी वजह से हमारा खून का सब तैयार हो जाता है, जो ब्लड सेल्स तैयार होते हैं उसमें व्हाइट ब्लड सेल्स कम होने की वजह से आपकी इम्यूनिटी, रोग प्रतिकार शक्ति कम हो जाती है। वो रोग प्रतिकार शक्ति कम होने की वजह से आपको कौन से भी रोग के साथ फाइट करने के लिए प्रॉब्लम होता है। अभी लास्ट 3-4 साल से जब हमें ये कोरोना हुआ था पूरे ग्लोब में, ऑल ओवर वर्ल्ड, पूरे जगत में जब कोरोना फैला था, उसका कारण क्या था कि हमारी रोग प्रतिकार शक्ति कम हो गई है। सो दिस कैन कॉज अ पैंडेमिक्स, जो रोग प्रतिकार शक्ति कम हो गई तो, और उसकी वजह से क्या हुआ है, पूरा वर्ल्ड हैज गॉन इनटू द फाइनेंशियल क्राइसिस, क्योंकि उस टाइम कमाने का कुछ नहीं था, वो सिर्फ दवाई और दवाई पे ही खर्चा चल रहा था। सो ध्यान में रखना कि क्या क्या हो गया। सो हार्ट की में होने की वजह से ब्लड प्रेशर का चेंजेस आ सकता है, लीवर के इसमें लीवर फंक्शंस होते हैं, पैनक्रियास में डायबिटीज आता है, ओवरीज के हिसाब से पीसीओडी होता है, इनफर्टिलिटी आता है, यूट्रस के इसमें एंडोमेट्रियोसिस आता है, पेनफुल पीरियड्स आते हैं। अभी इसमें यूट्रस का और एक मजा है कि यूट्रस के इसमें जब वो यूट्रस का मसल्स में स्टोर होता है डायोक्सिन, तो वो औरत जब प्रेग्नेंट होती, पहला उसको प्रेगनेंसी में डिफिकल्टी आती है, लेकिन समझो कैसे ऐसे वैसे कैसे करके वो प्रेग्नेंट हो गई। तो प्रेगनेंसी जब बढ़ती है तो यूट्रस में जो स्टोर किया वो डायोक्सिन है ना, वो प्लाजेंटा के थ्रू बच्चे तक जाता है। यूजुअली क्या रहता है कि कुछ कुछ दवाइयाँ, कुछ कुछ आइटम्स placenta doesn't allow to go to baby from mother, so we call it as a barrier. So transplacental barrier बोलते हैं हम उसे। So that transplacental barrier is crossed and then dioxin goes into the baby. So unborn baby who doesn't have any of its own fault, at birth only it is loaded with dioxin. See the gravity. The present generation is spoiled. The future generation to be born also is spoiled because of the dioxin and dioxin crossing the placenta. और जैसा ये बच्चा पैदा होता है तब क्या होता है कि माँ उनको डायपर डालती है। वो डायपर क्या है, इसका ही एक रूप है सैनिटरी पैड का, उसमें से भी डायोक्सिन जाता है। कोई माँ तो 24 घंटा रखते हैं, उनका गलत नहीं, उनकी गलती नहीं है, क्योंकि उनको मॉडर्न होना है। तो मॉडर्न के नाम पे हम क्या क्या कर रहे हैं, अपने खुद के अपने प्यारे लोगों के ऊपर कितना अन्याय कर रहे हैं, आप ध्यान रखना चाहिए। समझ लिया तो तुरंत बदलना चाहिए। What is important? The moment you understand you are doing wrong, immediately change to the right. That is very very important. So ये सब डायोक्सिन के प्रॉब्लम्स है। अभी इसके साथ उसको डिस्पोजिंग हैजार्ड्स भी है। डिस्पोजिंग हैजार्ड्स में क्या आते हैं कि वो जो प्लास्टिक के जो पैड्स है ना, आप जहाँ डिस्पोज तो होते नहीं क्योंकि प्लास्टिक है, और जहाँ फेंकोगे वहां उसको वो समझो जलाया, तो वो जलाए के फ्यूम्स कैसे आते कि पूरा एरिया खराब कर देता है। तो लोग वो इंसर्नेटर्स वगैरह लगाने के लिए भी ना बोलते हैं। सो ये इसका प्रॉब्लम है, ये सालों तक, 1000 साल तक वो वैसे ही पड़े रहते हैं। सो उसकी वजह से पूरा एनवायरनमेंट खराब होता है। और ये जब उसमें आपने मिट्टी में डाल दिया, सो इन द सॉइल इट विल कीप ऑन secreting dioxin, or that dioxin, that the soil becomes dioxin loaded, and if you plant anything in that plant also it goes, and if it is plant in that it goes, then you will get that dioxin through the yield आता है ना, जो कुछ उसमें से जो फल फूल ये कुछ लगता है उसमें से हमें शरीर वापस वो डायोक्सिन हमारे तक पहुंचता है। सो हम ही उसे फेंकते हैं, हम ही वापस लेना पड़ता है। सो ये उसका हैजार्ड है, वो बायोडिग्रेडेबल नहीं है। अभी मैंने आपको बोला कि ये सैनिटरी पैड का मेंस्ट्रुअल हाइजीन मैनेजमेंट का एक तरीका है। अभी ऐसे लोग बोलेंगे कि बाकी के तरीके भी है ना, तो वो है, बाकी के तरीके कौन से? द कॉटन क्लॉथ पैड्स रीयूजेबल। अभी कॉटन क्लॉथ पैड्स रीयूजेबल, ओके, इसमें क्या है ना, हम ओल्ड स्टोन एज में ऐसा ही बोलते लॉन्ग एगो, सो लॉन्ग एगो our previous generations were using cotton cloth, and it has got its own so many problems कि धोना सुखाना, फिर सोशल टाबू के हिसाब से वो उसको छुपके से यहाँ सुखाना, वो ढक के रखना, and all that to cover it from the, so in that bargain that this cotton cloth that has become a very tedious to manage as a menstrual hygiene management status. उसकी वजह से जब the moment a woman came out of the house to earn, that time for her it had become a burden. So slowly it started that sanitary pad. So now we went on that. अभी यहाँ तक पहुँचने के बाद again going back to the cotton cloth, no one will like it also. Second thing, if you say that cotton cloth is a washing thing is there, so that washing thing, everybody's definition of cleanliness is different. So what I feel as a clean may not be that clean. The next person may be having still more definitions of cleanliness. So इसमें क्या होता है कि cleanliness का एक उसका level नहीं है कि इतना धोया तो clean हो गया. Plus it is a blood. So blood तो कितना भी करो उसका अपना वो stiffness रखता ही है. That cotton after 3-4 uses, that cotton cloth will become stiff. It will leave its stains. So all that will be there, and still if you are using, because we are a people, Indian people who always try to use anything till the end. So वो हिसाब से किया, but then the stiffness and all or proper unwashing से हिसाब से fungal infections are very much known in the cotton cloth. Second thing, very important, अभी हमारा क्या है कि we have to say no to dioxin. So अभी ये cotton cloth पहले के इसमें जब पैदाइश करते थे कॉटन का वगैरह, कपास का पैदाइश होता था, that cotton was without any, they used to use compost for the yield, means वो उसको produce के लिए they used to use compost. Nowadays they spray chemicals to save it from the bacteria and all that. So what has happened that whatever the pesticides, germicides, herbicides, whatever are there, they all contain dioxin. So there is no thing, you cannot say that what cotton we are using is dioxin free, because in that only the cotton used for the making the cloth is loaded with dioxin. Second thing, it is given a color. Color is also having dioxin. So cotton cloth is not dioxin free. That is what I wanted to tell. First of all, it's inconvenience of washing and all that, it's question mark about its cleanliness and all, and third is it is not dioxin free. The thing is you have to take the decision. Third, tampons, as I've told, it has the same as a sanitary pad, so there is no telling anything extra in that. And when they say that it is high super absorbent tampons contain asbestos dust on it. So asbestos dust causes a severe irritation. Asbestos industries are closed and taken out of the place, and there is ban on that because asbestos is a highly carcinogenic. लंग कैंसर का बहुत ही उसमें ये प्रादुर्भाव रहता है. सो इसके लिए आपको टैम्पोन्स हाईली एब्सॉर्बेंट वगैरह यूज करने हैं नहीं, वो आपने सोचना है. और मेंस्ट्रुअल कप्स, अभी मेंस्ट्रुअल कप्स आर मेड फ्रॉम सो कॉल्ड नॉन इरिटेंट सिरेमिक एंड लैटेक्स मटेरियल. सो latex material or ceramic are non-irritant, that is they say, but ultimately it is a foreign body inside your body is always causing the irritation. There is no point. Again, you have to wash it, boil it after the full use of your cycle, and then wipe it around. Every time, boiling in the water, that water and that cup will definitely have some interactions. That over the period, definitely, because if we boil a water in any vessel, if we repeatedly use the same vessel, the layer will be there of the water, pure. That everybody knows it. So those whatever contents in the water will act on those materials. So that is there. And then second very important thing is that these cups are supposed to be once inserted, means every time insertion, removal, insertion, you have to, so many times it is fingering, inserting your fingers in vagina, which can from external side with through your fingers also you can pass infection inside. That is one thing. And second thing is when you have to empty it, whenever you want to reuse it, in the sense we have put a cup inside and want to empty it and again reinsert it. So that time they say that once you empty it, you have to wash it with warm water. If you are in a public place, there is hardly, at many times there is no water only. And if you are in other, wherever there is water, you don't get a warm water. So in these situations, how you are going to deal it with your sanitary, your cup to be cleaned. So that also there. And one thing is very much I am telling you that though it is very, very less, but till the toxic shock syndrome is known with the cups, because of that reinsertion, removal is, and then blood alkaline media, and it can cause a flourishing of the bacteria. So there can be local bacterial flourishment in the vagina and can cause toxic shock syndrome. There are deaths because of the toxic shock syndrome. So all these things you have to remember. And one more thing I'll tell you, any foreign body in your body is constant causing irritation is an invitation for cancer. That also one has to remember. For that, I will give you one example that when we were studying, we were told for the prolapse of uterus, they used to use a black rubber ring. That black rubber ring, because it is black rubber, that rubber is an inert material. So it is a body friendly and all. And then they used to insert it, that ring, and then after that it goes inside, it is to expand, and it is to push the uterus up. So uterus is to remain at its place. So doctor and patient both were happy. But down the line, after some years, there was sudden outbreak of vaginal cancer. So vaginal cancer was a very, very rare, it's a rarest of the rare cancer, vaginal cancer. But it was seen, and there was a certain outburst. And what was observed was those women who were using these rubber rings for the prolapse, exactly at that place, the cancer was developing. So immediately that was removed. And now the freely operations are done. Then it was not done because operations were not that common and not that easy. Now it has become advancement in the technology. We can do it very nicely. So that you have to remember. Another one thing, what I will tell you that for the contact lenses, I don't think any of the doctors use contact lenses. Whereas the cosmetically oriented other people, other than doctors, they use contact lenses. So understand, contact lenses affect directly come on your cornea. So that is why, because it is having causing irritation. So there are other damages because of that contact lenses. So that's why doctors don't use it. So this is what is I'm telling you. You should understand that what we use, that you should use. That is what the thing is. Now I have told you the all problems. The problems telling and then going out is not a proper thing. I should give the solution also. So only telling the problems, you will say that, hame to ye malum hai, now what is the thing? So solution, give us a solution. So the solution is only organic, dioxin-free, biodegradable, anion sheet sanitary pad is the only solution. So now you have understood there are many methods of the menstrual hygiene management, but solution is one. So solution is, this is the one. Now I have told you that usually the sanitary pad market available has got 3 layers, whereas sanitary pad which is organic has usually 7, 8, 9, like that, more than 7 layers for the this. And in that different layers will there, 2 absorbent layers will be there. And then, so now I'm coming to the point that I want to tell about my sanitary pad. Why I started my own sanitary pad is because I knew that I can give this as a solution. but solution should be viable. Viable in the sense people should accept it freely, because if it is pocket friendly, then only they can accept it. I can tell you that कि उस चंद्रमा कितना सुंदर दिखता है, आकाश में बहुत सुंदर दिखता है, but how to reach there, how to go that, it is not possible. चंद्रमा नीचे आया तो ही you can enjoy the beauty of it. So like that, if it is a very costly thing which is beyond your reach, you will not, you will say yes, yes, and then tomorrow you will forget about what I because in organic market, organic pads are very costly. They start anything about around 250 rupees per pack. There's a pack of maybe around 7 to 8 pads and above. So the normally we are very popular are around 300 plus. So like that, the thing is there. So everybody's health is everybody's right. So right from the poorest of the poor and richest of the richest, both of they do deserve health. So then I should make something which can be available for both of them. It should be pocket friendly and should be available freely. So that is why I started my own. So my pads has got 7 layers. Sir. It has got a ultra fine surface layer. Then all are plant-based. My product is plant-based. Second is aniline sheet. Then there are 2 layers of the absorption layer will be there. And then in that hydrophilic, hydrophobic layers will be there. And then the last layer will be sticking agent. So this when is there, this is the sanitary pad and these are my pouches. So what are the benefits is that they are anatomically shaped. Then they give comfort. The absorption is that I will just now ask Manju madam to play the video to show the absorption capacity. But let me just complete this. So that fully made from corn plant-based items, sir. And it is biodegradable. It is proven with the with researchers and everything. Within 12 months it is totally biodegrades into the soil. And that soil is checked in the NABL accredited Krishi Vidyapitha, Raichura, and they have told that it increases the control soil and test soil 400 times increase in the micronutrients. So it is so rich in the micronutrients when it is dumped in the ground. So you can imagine today you are using sanitary pad, dumping it in the ground. After 1 year, you can start compost factory, compost unit. So that can give a very rich compost for the plants. And there is no further headache of disposing your sanitary waste, sanitary hygiene products. So it is so easy. Today you start one industry, next year you start a second industry, automatically it gets into that, then use, and there is no civic body problem, nothing will be there, and you will enjoy the life while using it and even after throwing it. So that is very, very important. You should understand this. My product is accurate test. So this is what I have given the cycle is, this was 24/10/2021 dumped in soil, watered daily. Then after 7 months on 18th May 2022, pad pulp totally dissolved, outer cover degrading. This was the outer cover degrading. This is the outer cover was degrading. Pulp was totally dissolved. Then in this, it was totally almost 18th July 2022, quarter covering. Outer covering also was totally cut into pieces on the verge of complete decomposition. And then on November, the date is put so on November it was so it was totally decomposed into the soil. This is the place where it was dumped. Totally it is into the soil, and its soil was tested, and soil testing has given the good results. And my pad is sanitary pad is Testex India Laboratory, which is a authority for the sanitary pads, because sanitary pads come in the textile compartment. and not in the electronic compartments, not in the drug and manufacture. So ISI, then drug and food status, that body which approves drug and food, DCG. So that doesn't give any value to their certification. So what is important is the textile companies, textile product certified companies should do it. Laboratories should do it. So Testex India, Bombay version has given its certification. So the certifications are there. Then I have just given it here. Test report of University of Agriculture Sciences, Raichur, Karnataka. So this is they have given the test reports. So all that is there. Madam Manju, can you play that video? Showing the decomposition, showing the absorption capacity. To demonstrate the capacity, absorption capacity of my pad. My pad is this double XL size, its capacity is 250 ml absorption. Though it is very thin, it absorbs completely and it doesn't allow any fluid to leak outside. This is an ordinary non-organic sanitary pad. I don't want to mention about any company's name. And this is the gel sheet which is used in the pad manufacturing of these pads. So I want to demonstrate that in every capacity it absorbs 250 ml. And same time I want to show that how non-organic pad of other company, though it may claim anything, how the things are leaking and non-leaking. So this is a 250 ml fluid which I will be putting it to demonstrate that my capacity of my pad. So this 250 ml I am putting it in this jar and then allowing this gel sheet to enter in this. Okay, now just go on seeing it, close observation. Then comes a pad of non-organic pad of other company. I will just go on pouring fluid over that and see how the fluid is getting into it. Slowly, 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 slowly I am pouring it. Slowly, 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 slowly I am pouring it. You can, because of the coloring of the water, the fluid, you can clearly see where that water is going, the fluid is going, whether it is leaking outside or not, and whether it is absorbed from the outside inside. So you can just see it. See how the things are happening. The pad is already full and it is allowing the water to leak out, fluid to leak out. The claim of the pad that it doesn't allow leaking. See, only this much water is still there, and in spite of that everything is coming out. Everything is coming out. Do you want me to complete it? But I will do it since I have to show it to the people. So this is the status of non-organic sanitary pad with so much of spillage of fluid outside. And now this is my organic sanitary pad. Now you have to see it very closely, because the moment it is trying to come outside, it is sucking it inside. Just see closely. See, so beautiful it is absorbing inside. See how it is absorbed inside. It is absorbed inside. It was slightly had come out, but it dragged it inside. The wings dragged it inside. See how it is nicely absorbing. See. So now all 3 trials are done. Here is the one non-organic. When 250 ml fluid is put, it is filled and it is leaking outside. This is my organic sanitary pad of 250 ml capacity. It has absorbed everything and it has totally leak proof. Then this is the gel sheet. Now see the maja of this gel sheet. The absorption is so complete that it is now, if you touch it, it doesn't give any watery feeling. Your finger remains dry. Absolutely. So there is no water leakage outside. It is totally absorbed. Now this is the pad. If you take it out, this is the pad. Whereas this is the pad. This is the 250 ml capacity. See, I am pressing it. I'm pressing it, I'm pressing it, I'm pressing it, and no fluid outside. See, nicely I'm pressing it, no fluid outside. Whereas I'm pressing it and it is leaking outside. I'm pressing it, no fluid outside. So you saw the beauty of the absorption. Now once you put this in the excess of water, this gets dissolved in water. So in that way disposing also can become complete. If you put this in the mud or ground, dump it in the ground, it totally dissolves there within 15 to 20 days, and then that pad is no more there existing. So disposing of the organic scented pad becomes very easy, whereas this non-organic will take 500 years to decompose. So this is how the demonstration of my pad is. The claims what we claim are proven with its actual capacity. Okay. Come back. No, ಇದು ನಮ್ದು ಎಂಡ್ ಮಾಡೋದಿಕ್ಕಲ್ಲ. To the point. So now we have seen the demonstration of the absorption. Now what is the end result is I have given you the all knowledge. Again I have come back to the Parameshwar, Krishna and Arjuna, best guru and shishya. So that is what I felt I should again tell. At the end of Bhagavad Gita, what Lord tells her to Arjuna, that Baba, I have taught you so many things now all throughout this 18 adhyayas, that Raja Yoga, Bhakti Yoga, Jnana Yoga, then all this Karma Yoga. So all that I have told you, you have understood it. Now it is your turn, that whatever he is appealing to you, take decision and behave accordingly. So like that, I will also, I have told you remaining everything, all methods of menstrual hygiene management and all. So now you have to choose between what you want to take and use. But whenever it comes to choosing, you will always like to choose the best. So choose wisely, choose health, and choose organic. Not only organic sanitary pads, but even the food items and anything which you will use organic only, because that will give you a longevity and healthy life for you and your future generation. So with this, I thank you all for being with me for this. And now I am open for the question and answer session, if you have anything. I think we can come to the main this.
Om Shanti. Thank you so much, ma'am, for the wonderful session. बहुत इनोवेटिव चीजें और नए नए इन्वेंशन जो आपने हमारे सबके सामने रखे, बहुत इंफॉर्मेटिव सेशन रहा। वैसे बहुत सारी चीजें फर्स्ट टाइम हम सभी पार्टिसिपेंट सुन रहे हैं, और जो चीजें आपने हमें क्लियर की है उसे हम जरूर फॉलो भी करेंगे। तो जो भी पार्टिसिपेंट अगर मैम से कोई क्वेश्चन पूछना चाहे तो आप जरूर पूछ सकते हैं, अनम्यूट करके पूछ सकते हैं। वैसे चैट बॉक्स में सभी आपको थैंक्स दे रहे मैम।
थैंक यू वेरी मच।
थैंक यू सो मच मैम, आपने इतना बिजी समय में से भी हमारे लिए समय निकाला, इतना वैल्यूएबल गाइडेंस किया, और हमेशा ऐसे ही हम सभी के साथ जुड़े रहे। तो आपका होलिस्टिक IVF एंड IUI की टीम्स के तरफ से, ब्रह्मा कुमारी के तरफ से बहुत बहुत धन्यवाद।
वैष्णवी मैडम ने एक पूछा है क्वेश्चन कि आई हैव वन क्वेश्चन, हाउ टू गेट दिस पैड्स, आई वांट इट फॉर मी, माय कजिन फ्रेंड्स, आई एम गोइंग टू एनकरेज देम ऑल to use it. Thank you, madam, very much. That because this is what I say, that instant, the moment you understand what you're doing is wrong, immediately change for the right. And this is the instant reaction from Vaishnavi madam. And you should be an example to role model to all women on the earth that take the decision immediately. See, in the beginning, when there was a video was played, it was the mobile number was given. That is my mobile number. Should I say it again? I will just write that number.
मैम आप ओरली बताइए, मैं टाइप करके भेजती हूँ सब।
77
यस
60
हाँ जी
93
यस मैम
10
हाँ जी
38.
Okay.
On this number, if you say, this is a WhatsApp number, if you send your name, full your postal address with PIN code and your requirement, if you send this thing on my WhatsApp, immediately you will get it through courier services, because I will send a issue with a bill. As soon as you pay it in that account, you will get the stock. Anywhere in India, now sometimes some people for outside India also I am sending. So that can be done, no problem. And I have to tell also, no, the rates also I have told, because I told the higher rates of other thing. Now the rates of mine are, I have got 3 sizes. One is a regular size, one is double XL size, regular size and compact size. So double XL size is 320 into 80 mm. which I had demonstration. During the demonstration was shown, that was a double XL size. Its capacity is 250 ml. Presentation of the pouch is 8 pads in one pouch, and cost is 150 rupees for 8 pads. The next is a 280 into 80 size. Presentation is 8 pads in one pouch. Its absorption capacity is 150 ml. And to say that it is a double, you have got a stay free extra large size, no? A little bigger than that my regular size will be. And the cost is 120 rupees for 8 pads. The third is a 240 into 80 mm size. Absorption capacity is 100 ml. And 8 pads presentation, 100 rupees for 8 pads. So these are the absolutely affordable rates. Water, because you're going to get the fully certified sanitary pad, and those people who are going to use these pads, the benefits of anion sheets are, which I just skipped little, or I missed it rather, that menstrual cramps totally go away, then mood swings go away, your blood flow gets regularized, in the sense the heavy flow comes down to around 4 to 5 days, per day bleeding also comes down. Then if it is very scanty flow, it improves to 4 to 5 days. So that also is there. Then mood swings, I said. Then even that those people who are very much disturbed, in the sense mentally having some problem, no, like mentally retarded or something. So those people, girls also, when they are using this, they calm down a lot. And then you get definite protection from, I told, the dreaded diseases. So that also is there because of the anion sheet. Anion sheet is a boon in that sanitary pad. So it gives a lot of benefits. So that also is there. So I have given my complete information of my pad now.
थैंक यू सो मच मैम, बहुत बहुत आपका थैंक्स है. और कोई क्वेश्चन पूछना चाहता है मैम से? ओके, सिस्टर राधिका ने आपसे क्वेश्चन पूछा था मैम, और आपने नंबर भी दिया. सो आई थिंक इसी के साथ हम सेशन को वाइंड अप भी करेंगे. मैम, सभी पार्टिसिपेंट्स की तरफ से पुनः एक बार बहुत बहुत थैंक्स.
So everybody enjoyed the session, isn't it?
लॉट्स ऑफ मैम.
Thank you.
बहुत इंटरेस्टिंग सेशन था, और बहुत नई तरीके से आपने हमें बहुत सारी नई नई नॉलेज हमें मिली, जैसे डेली रूटीन की, और खासकर वुमेन्स के लाइफ में ये सारी चीजें बहुत अवेयरनेस होना या प्रैक्टिकली बहुत इम्पोर्टेंट है. और कुछ कुछ एज के बाद हम थोड़ा सा उसके साथ मैनेज करना या एडजस्ट करना सीख लेते हैं, जो कि अवेयरनेस थोड़ा छोड़ भी देते हैं बीच बीच में. तो इसीलिए आज फिर से हमें वो सारी नॉलेज मिली, इंफॉर्मेशन मिली, गाइडेंस मिला, इसलिए बहुत बहुत थैंक्स मैम.
Thank you very much. I'm ready for these awareness programs, any number, because my main aim is that only. Because I want the whole world, globe should be getting that menstrual hygiene properly.
Yes. Thank you so much, ma'am. Thank you.
Thank you.
Thank you. Om Shanti.
We'll leave now.
पट खोलो, आज चेतना के पट